From studios at the Milwaukee Journal-Sentinel, this is Fourth and State. In this edition, a chat with Bevan Baker about what it's like to be on the front lines of the battle for better health care in Milwaukee. I'm David Haynes. I'm editorial page editor of the Milwaukee Journal-Sentinel. Welcome to Fourth and State. I'm joined today by Bevan Baker, who is Commissioner of the Department of Health in the City of Milwaukee. Commissioner Baker, welcome.
Thank you. Glad to be here.
Thanks for being with us. As Health Commissioner, you have a big portfolio. A lot of different issues come across your desk. Everything from diabetes to a range of health issues, infant mortality. I want to just start with infant mortality. It's something that our newspaper paid a lot of attention to in the last year, and I know the department has as well. Specifically, the aspect of it related to co-sleeping. The department put a lot of time and effort, and in fact money, into a campaign to raise awareness. And yet already this year we've had, I think, 4 or 5 deaths related to co-sleeping. Is the message getting through? Are there other things that the department can do, other things that the community at large can do?
Well, I want to just recognize that infant mortality reduction as a whole is a very complex issue, and bed sharing, co-sleeping is just one aspect. Yeah. And while the department and the city and many others in the public health community have put a lot of time and effort here, and while our messaging has been at times very provocative and very forward, the fact that we've had a few deaths to start the year does not mean that we should retrench at all. I do think that this is for the long term, and while our messaging may not be reaching all of those, you don't stop giving good messaging just because there's still the concern that you were messaging about.
You've got a new campaign about to come out, I believe, right? A new ad campaign?
And we do. We have a new campaign that will not only illuminate just the importance of prevention, but also we'll tackle this issue in a different fashion. I think that what we've learned and what most who are in marketing and advertising learn is that you can gain attention of a lot of people very quickly with certain marketing strategies.
And you had a very provocative campaign last year.
But that's not what we're all about.
Right.
We're about making certain that we can change population health. So our next campaign will be different. It will hopefully be just as effective in getting the community's attention, however.
There's an effort in the legislature to make co-sleeping a criminal offense. What do you think about that? Should it be?
Well, you know, I know that that's in a draft format right now, and I've seen the draft, and I certainly have concerns there. I haven't been persuaded by the draft as I've seen it. I do believe that we have to be very careful. We have to look at every situation individually, and I think we need to leave certain components of the criminal justice system to the criminal justice system. I think there are child neglect and abuse laws on the books. I think they can work if indeed they are utilized. But I'd have to see more. In general, I don't want to demonize and have a victim be victimized again by criminalizing this process. So we'll just have to see where the legislation takes us.
Okay. Let's shift gears for a moment. The city got good news recently when Aurora Healthcare said that it would maintain most services at its Sinai Hospital near downtown. But I wonder if you have some thoughts on what the community at large should be doing, the health systems, the health department, and others, to sort of avoid a lurch from sort of one crisis to the next in terms of the quality and access to care.
Well, first I think the fact that the situation surrounding one of our large urban safety net hospitals got everyone's attention, and it showed in a very quick fashion just how fragile the overall healthcare delivery system and the safety net is. I hope that what this has led us to is a broader discussion around healthcare access and utilization of services and getting medical home for those who need them. There's a role for the city, there's a role for every hospital, every federally qualified health center, and a role for physicians and caretakers in the community. it's great that we're having this discussion, but I think that the broader community has got to understand that there's many things happening in Wisconsin and federally that's going to impact what happens here. We're not out of the woods yet. For the next 4 or 5 years, it's going to be very, very difficult to toe this line, but we're all in this, and we're going to have to do a good job of addressing it.
Are the hospital systems doing enough on that issue in terms of access to care?
I think that they're doing all that they can. Can they do more? Should they work harder? I think that yes, but they are doing all that they can. What they need to do is to work with all of us to make certain that their strategies are meeting the community needs at this time. So I'm going to hold them to their accountable for the fact that they're willing to try everything to keep this healthcare delivery system intact.
I want to ask you about the Healthy Youth Act. By the time this video is posted, it may have been repealed by the legislature. That's being debated today. Yes. I wonder what you think about that repeal and what you think about the idea that Mary Lazy Chibney-Berlin, who advanced the bill, has made, that school districts ought to have the right to sort of make up their own minds about whether they choose abstinence-only education or a comprehensive approach.
Well, I'm saddened by the fact that we're going to have ideology trump results. What we've been able to do in southeastern Wisconsin, and particularly in Milwaukee, with teen pregnancy prevention and reducing teen pregnancy and making national and international news in doing that, has been in part because of our relationship and working under some of the provisions that are in the very act that they hope to repeal. It will be a sad day in Wisconsin if they move us back. And I would hope that as the legislature debates this issue, that they would think hard and long. It's unlikely to happen, but we have made gains here, and I think that we need to look for results that will change the future of Wisconsin, not making legislation that will send us back to a past that we are all trying to overcome.
Mm-hmm. And what about that argument, though, that she's made and other Republicans, conservatives have made, is that, well, the districts ought to have the right to sort of make up their own minds rather than be told they can't have abstinence-only education?
Well, I think that's a slap in the face to public health and to practitioners and parents and guardians and caretakers all across this great state of Wisconsin. We've seen results with the conditions on the ground being as they are. I think that is a easy man's way out of saying that we need to give that authority back to some of those communities. We need to keep the Healthy Youth Act in place, and I'm really sad that ideology is going to trump public health.
You wrote last year in an op-ed for the Journal Sentinel that failure to invest in policies to reduce poverty and unemployment, and I'll paraphrase here, will certainly result in a continued decline of physical and economic health, not only in the state's least healthy cities, Milwaukee being one of them, and counties, but for the state as a whole. If you were talking to a group of people from suburban Milwaukee where these problems are much less apparent, what would you say to them? Because they might argue, and I've heard it, we see it in our emails sometimes, you hear it on talk radio, that we get it, we are a brother's keeper, but at the same time, a lot of this is about personal choices. How much of it is about personal choices, and how much of it is about the entrenched problems that we've talked about?
Well, certainly one can't throw out the entrenched problems, but the whole notion of health equity suggests that everyone needs an equal opportunity to be healthy. And I think when you look at this from a very unbiased view, it is clear that as goes Milwaukee, goes the state. We've got to make investments into making certain that everyone is healthy. Disease has no borders. And if the whole cohort of people in the poorest parts of our city in southeastern Wisconsin can't have an equal opportunity to be healthy, then eventually that will seep out into our suburbs and across this great state of Wisconsin. We've got to invest into today's issues for tomorrow's future to be brighter in Milwaukee and in Wisconsin as a whole. So I dismiss the notion that you can't do both. You have got to make investments into everyone having an equal chance at being healthy. And then only then will Wisconsin be the great state, and then only then can we move forward.
Well, Bevan Baker, thanks so much for being with us on 4th and State, and join us next time for another edition of 4th and State.